Additionally, we have specialized bone structures, which we reference as the bony landmarks. These structures allow for the bones to move around each other or allow for the bone to attach to other bones or allow for other things to attach to the bone or allow for things to pass into or along the bones. These include classifications such as articulating surfaces, condyles, facets, heads, and trochleas, depressions such as alveolus, fossas, and sulcuses, attachment sites and projections such as crests, epicondyles, lines, processes, ramiges, spines, trochanters, tubercle, and tuberosities. The difference between each one of these is about the size of the projection or attachment site and the robustness of the attachment site or projection, which is based off of how many things are attaching onto it and what is the strength necessary to resist the physical lines of pull that those attachments happen to have on the bone. And then we have openings such as canals, fissures, foramina, sinuses. Once again, the difference in the terminology here on the openings is how large and what shape do they take. So let's take a look at what some of these look like in terms of their structures. We'll get more detail into this when we actually look at the bone landmarks on the skeleton itself. So we have things like fissures, such as the superior orbital fissure. We have things like the foramina, which is going to allow for passage of the nerves, such as the infraorbital foramina and the mental foramina. Sinuses, such as what we see with the frontal sinus indicated. A lot of times the sinuses are there to provide hollow spaces within bones so as to reduce the overall mass of the bone. So we'll see a lot of sinuses within the cranium as opposed to other bones through the body. Alveoluses, such as what we see the maxillary and mandibular teeth sit into. Canals, such as the external auditory or acoustic canal. We can have attachment sites, such as trochanters, tubercles, tuberosities, ramus, epicondyles, crests, spines, lines. Notice the difference in size of each one of those. Notice how the trochanter is much larger than the tubercle, and the tubercle is slightly larger than the tuberosity. And then we have articulations such as heads, which are usually going to be convex in nature. However, there are some heads that are not convex, such as what we see here in terms of the convex heads of the femur and the humerus. Trochleas, condyles, such as the condyle of the mandible. Facets. A lot of times we'll see facets within the vertebrae, and they're going to allow for articulation of a superior vertebrae with an inferior vertebrae, allowing the vertebrae to stay in touch with each other and keep an erect posture without needing excessive amounts of muscular strength and or contraction. And so we'll get a lot more detail into these distinct structures as we go through the skeleton, but please make sure you understand what the various forms happen to be based off of the classifications of, are they an articulating surface? Are they a depression? Are they a attachment site? Are they an opening within the bone? And so let's take a look now at the microstructure. When we're talking about microstructure, we're talking about the actual tissue, the histology, in which we're looking at the cells, the osteocytes in their dormant lacunae, the osteoblasts when they are going about building tissue, or the osteoclasts when they're going about recycling the tissue. The osteons, which is the formation of the concentric ringed lamina. The canalicles, which are going to be connecting the lacunae of the osteocytes to each other. the Hervatian or central canal, and Volkmann's or perforating canal. The lamella or lamina of the bone, the lamella or lamina of the bone is the bone matrix. This bone matrix itself is comprised of two parts. The first part is an organic protein compound, primarily type 1 collagen proteins with lesser glycans, such as proteoglycans and glycoproteins, and then a citrate molecule that forms with water a hydration barrier in between the layers of the matrix. It's this citrate that allows for a non-brittle matrix to form. And it's the citrate that is consumed with citric products that is necessary for good bone health in terms of diet. Most of the times people will talk about diet in reference to calcium and in reference to vitamin D. However, if you really want to have strong bones, you have to load the bones and you have to make sure that you have a fair amount of citrate in your diet so as to allow for non-brittle bone formation. The majority of the bone matrix itself is an inorganic crystal salt known as hydroxyapatite. It's a calcium phosphate system. And then you have about 4 to 8% of the overall weight of the bone coming in water. Bone is a hydrated tissue, and the hydration allows for the bone itself to flex and bend without actually breaking. If we look at the way the bone is formed, the matrix develops through progenitor fibroblasts laying down collagen fibers. This initiates the activation of the osteocytes, which starts to lay down hydroxyapatite onto these proteins. The hydroxyapatite arranges itself in a positive-negative arrangement, fixing the collagen within the bone matrix into a crystalline lattice. This crystalline lattice is held in place by ionic charges in between the positive and negative ends to the hydroxyapatite crystal. They will lay themselves out in a banding pattern. This banding pattern is held in place by the hydrogen bonding attraction in between the citrate molecule and the hydration layer in between the hydroxyapatite layers of salt crystals, where the hydroxyapatite layers are allowed to slide across each other, but the hydrated layer with its citrate molecule forms this kind of goo within the healthy hydrated bone, where the matrix itself will flex and bend without coming apart and breaking. It's one of the ways in which bone becomes a very strong crystal structure as opposed to a very fragile crystal structure. One of the reasons why bone fracture increases as people age is because of increased risk for dehydration within the tissues, limiting that hydration layer, secondary to loss of bone mineral density due to disuse. So those layers of crystals will lay themselves out in such a way that they will orient into what's referred to as Hervatian canals. The Hervatian canals start with the formation of the osteoid, in which we have the collagen fibers being exuded out of the fibroblasts, initiating the activation of the osteoblasts, leading to the formation of the bone matrix. Based off of activation sequences and physical loading, this osteoids will start to rearrange themselves, and they'll rearrange themselves based off of how forces are being laid upon them and the tensions of the connective tissue next to them, in which to the cortical side, we get parallel concentrically ringed lamina, whereas to the trabecular side, we get irregularly oriented ringed lamina, in which we form what are referred to as spindles or spurs of trabecula to the medullary side, and then concentrically linked Hervatian systems to the cortical side. In the central canals of each of these regions, we will see the nutrient arterial and nutrient venule passing through. They will have capillaries that will perforate out through the canicules to allow for constant perfusion of the bone at all times. If we further break this down and look at actual histology of the bone, so here's an actual slide, we have our canals, the central or Hervatian canal within the ringed laminate, and then we have the Volkmann's or perforating canal, which is going to be in between that concentrically ringed laminate. Notice all of the little dots in the slide. Each of those dots is a lacunae, and inside each of those lacunae, we have an osteocyte. Connecting each of those lacunae are the perforating lines heading through the concentrically ringed lamina. That is the canicules. The bulk of the slide is lamina. That is the bone matrix. If we take all of that together, the macrostructure and the microstructure, and put it together, we get a bone that looks something like this, in which to the medullary side we have the trabecular spindles, and to the lateral side we have the concentric lamina. In the center within the medullary cavity of the lung bones, we have the nutrient artery, nutrient vein, and nerve to the bone. Those will then enter into the bone matrix itself through the trabecula and then interact with Volkmann's or the perforating canal. They will pass through until they hit a Hervatian system, at which point in time they will then go along the length of the Hervatian system within the Hervatian canal or the central canal, connecting the lacunae to that central canal are the canicules. The canicules are held in place by the fibrous tissue that is coming from the endosteum and running into the periosteum.